Hello, I'm Dr. Adam London, Director of the Kent County Health Department. Thank you for checking out this website to learn more about the COVID-19 vaccine. It is my sincere hope that you, your family, and your friends are well. And I want to thank you for all that you have done since this pandemic hit. COVID-19 has impacted all of us differently. Some of you may be serving on the front lines in our hospitals, caring for COVID-19 patients, and trying to keep your own family safe. Some are providing the essential services our society needs to function at grocery stores, pharmacies, and so many other jobs that ensure our health and our welfare. Many of you have had to balance at-home schooling and your own careers. And sadly, many of you have had to face the loss of a family member or a friend. I want to express my deepest sympathies for your loss. The Kent County Health Department values every life and takes each death personally. Thankfully, good news is on the horizon in the form of vaccines that can prevent COVID-19. These vaccines are the weapons that can turn the tides of this war from a defensive posture to an offensive strategy. We all play a role in that strategy, and we need as many people as possible to take this vaccine when it's available in order for it to protect us from the virus. We've launched this website to answer your questions about COVID-19 vaccines. We will be transparent throughout this process. We will use this website to tell you about the benefits of the vaccine, and we will also tell you what we know about side effects. We are committed to bringing you the latest news and information about when and where the vaccines will eventually be available and who is eligible to receive them. In the next few minutes, I want to tell you more about what we know, and more detailed information can be found on this website. The federal government and scientists around the world have been working since the pandemic started to make a COVID-19 vaccine available as soon as possible. The CDC has been working with health departments across the nation, including the Kent County Health Department, to develop vaccination plans. While there are several vaccine candidates in the pipeline, so far two that were developed in the United States, one from Pfizer and one from Moderna, have successfully completed 3 phases of clinical trials. The United States has the most rigorous vaccine approval process on the planet. No steps are being skipped in the approval process. The vaccines have been tested on tens of thousands of people. The effectiveness and the side effects are well documented. One of the only things we don't know yet is the 1 in a million side effects that will only come once millions of people have received the vaccine. Only 2 to 10% of the people who took part in the trials experienced any side effects. Most of those were very mild, and no one was hospitalized as a result. Side effects ranged from high fever, fatigue, joint and muscle aches and headaches, to redness at the injection site. It's important to point out that if a person does get side effects, it does not mean they are infected with the virus. You cannot get COVID-19 from the vaccine. Local healthcare workers will be among the first to get the vaccine, and they will be using an after-vaccine health checker to provide additional data. Anyone who gets the vaccine may use the vaccine reporting system to report undocumented side effects. This system is already used with other vaccines and immediately alerts health authorities to any possible issues. Both vaccines are close to 95% effective. Efficacy is consistent across age, gender, race, and ethnicity demographics. Both vaccines require 2 doses. The time between the doses varies, but it is important to get both doses within the established timeline in order for the vaccine to be fully effective. Initially, quantities of the vaccine will be limited. For that reason, the U.S. Centers for Disease Control and Prevention has established a tiered system of who will get the vaccines and in what order. At first, vaccine distribution will be limited and prioritized to frontline healthcare workers and to residents of long-term care facilities. Once these 2 groups are vaccinated, the CDC will likely focus on essential workers, including EMS workers and first responders. These workers are considered part of America's critical infrastructure. The next group to receive vaccines will be high-risk populations such as those with pre-existing medical conditions and people who are 65 and older. In 2021, the vaccine supply is expected to increase substantially. Current models suggest that anyone who is not within the initial priority groups will be able to get a vaccine by April or May of 2021. The vaccines themselves are free to all. A small charge may be assessed to health insurance providers by the agency administering the vaccine, but there will not be any out-of-pocket cost for the vaccine. The Kent County Health Department looks forward to playing a pivotal role in the vaccination process. We will have the responsibility of storage and management of much of the vaccine supply in Kent County. Because the vaccines require ultra-cold storage, a specialized freezer that can hold a large number of doses has already been installed. KCHD nurses and staff will administer the vaccine to certain groups of people. More information on that will be coming very soon. I happen to agree with Dr. Anthony Fauci, who calls these vaccines a game changer. It is possible that things could look very much normal again by the second half of 2021. But in the meantime, we will have to continue to social distance and wear masks to avoid contracting and spreading the virus and overcrowding our hospitals. And we may continue to see rolling shutdowns to keep the disease at bay. The fact that you have come to this website tells us that you are hungry for knowledge. As new information becomes available, we will update this website with frequently asked questions and with trusted, science-based data about the COVID-19 vaccines. Because here at the Kent County Health Department, we want to help you be someone who gets it.